Hello everybody, welcome to Wellbeing Makes Sense. My name is Serge.
And my name is Claude.
Today we have a special guest with us, Mr. Russell C.E.Y.A.T, and we will be discussing together asthma. That is a very, very prevalent disease, so I hope that you'll stay with us. Thanks for staying with us. So today we have Russell with us, and who is a respiratory therapist. So welcome, Russell, to our show.
Thank you so much for having me, Serge.
So tell us a little bit about you.
Well, as you said, I'm Russell C.E.Y.A.T. I am a respiratory therapist, and I have been working in the field for about 8 years, and I work for Albany Medical Center in Albany, New York, and I'm pleased to be working with different kind of people who have respiratory illnesses.
All right. So thanks for being here once more. So how about you start telling us about asthma? What is asthma?
Okay, so asthma, as you know, I know you are a medical professional, but asthma, for those who are watching, asthma is a chronic disease that involves the airways of the lungs. So these airways in your lungs, or the bronchial tubes you have in your lungs, their main function is to allow air to come in and out of your lungs. So when you have asthma, your airways or your bronchial tubes are always swollen, which makes it very difficult for you to breathe.
And it says that asthma affects about a whopping 34 million people in the United States, and the breakdown for kids is about 8 million of them suffer from asthma. So how does one diagnose asthma?
Well, wheezing or tightness in your chest can be very serious when you have asthma. So you should let your primary care professional know of the symptoms that you have. So if you let them know, they may help you. So what do? They get a health history, a family history of you as a patient. They also do a breathing test, so where you have to go through what we call a spirometry test, just to make sure that you can exhale air out of your lungs. And also they have, to diagnose asthma, so they have a follow-up exercise challenge test that you may have. So if your breathing test shows that you have asthma, your physician may give you a drug to inhale, such as albuterol. If your breathing test number improves after you inhale that medicine, then the diagnosis of asthma is more likely.
Yeah, but tell us a little bit more about the symptoms, the sign. What would the patient feel?
So basically, symptoms would include wheezing, coughing, shortness of breath, and also tightness of your chest. These are the symptoms that you may experience.
Once a person comes in, right? We both work in the ER, that's one of my colleagues. So someone comes in wheezing, complaining of chest tightness, have a history of asthma. as a RT, what is your job?
Okay, so if I work in the ED at that day, during that time, so they would call me up to assess the patient. So the first thing I do, I visually assess the patient and looking at the way the patient is breathing, I listen to breath sounds. If any wheezing is suspected, so the first thing you do, you would administer a bronchodilator, which is an albuterol treatment. And then you follow up after 30 minutes to see if there is any improvement. If there is no improvement, you could repeat the treatment. And then after that, you could take some step forward if there is no improvement after the first or the initial dose.
And so when talking about asthma, I mean, we also have to look at asthma attack, which is really when they are in that crisis state and they are in need of emergency most of the time. So tell us, what can trigger those asthma attacks?
Okay, there are so many factors that could trigger an asthma attack. So if you have common allergens, that includes dust mite. So dust mites are very, very tiny microscopic organisms, relatives to a spider, and they live on mattresses. They also live on beddings, on furnitures. They live on carpets. The dust mite also could live on any curtains that you may have. Animal dangers also could trigger any asthma attack. What are animal dangers? They are tiny, very tiny little particles that are shed, from animals, especially cats and dogs. So when the dangers are left behind and then you inhale them, so it may trigger an asthma attack. Also, tobacco smoke. If you are exposed to any smoking, it could also trigger an asthma attack. Air pollution, also any strong odors, any very strong smell. If you are exposed to that, it could trigger asthma attack. There are so many things. If you are very stressful, emotionally stressed, your asthma may trigger. We also learn about some medications that may contribute to trigger an asthma attack. So these includes aspirin or any non-steroidal anti-inflammatory drugs, such as ibuprofen or any beta blockers. So these are medicines that they use to treat heart disease, high blood pressure, migraine, headaches, or also glaucoma. So these are just a few of the elements that could trigger an asthma attack.
So basically, a person suffering from asthma really have to know what their triggers are, because not all these triggers would affect everybody. So you got to know which one really affect you, and so that you can.
So I believe your immune system, has to play a role in how you react to any exposure whatsoever. So you may be exposed to an allergen today, and you don't have any effect to it. And somebody else may expose to the same situation, but there is a reaction to it. So it will depend on your immune system. Yes.
So, in your line of work and your studies and your background in asthma-related issues, is it something that someone is born with, or something that they acquire along the way in their life?
So I believe that it's both. Asthma could be genetic, and also it could be acquired. So if your biological parent, has asthma, or they had asthma in time past, so you are more likely to develop asthma.
Tell me a little bit about the medications that they use. Do they have any side effects, anything that we should be concerned with?
Well, well, I believe that any medication you take, okay, it's not only related to asthma, but I believe that any conventional medicine that you take, there is a side effect to it. As you know, asthma is a chronic disease that requires an ongoing management. It includes using proper medications to prevent and control the symptoms, and to reduce the inflammation you may have in your airways. So we have two general classes of asthma medications. You have we use in the hospital like a quick relief and a long-term control medications to manage asthma. So the doctor may recommend one or a combination of two, depending on the situation. So the quick relief medication, they are used to provide temporary relief of symptoms and times, and also they are rescue medication also, and they are bronchodilators that we use to provide relief to these symptoms. So what the bronchodilator does is to open up the airway so that more air can flow through. So as soon as you inhale the medication, or if it is through a breathing treatment, it will quickly open up the airways. As the airways, they can be inflamed. So as soon as the medication gets in, so it will open up the airways, so you can breathe a little bit easier. So bronchodilators, again, they are primarily short-acting beta agonists that we administer by an inhaler or through a nebulizer machine. Yeah.
So, we always recommend that people with asthma, they always walk around with their rapid
Rescue.
inhaler.
Rescue inhaler, yes.
You have to have it on at all time.
So mostly people who suffer from asthma, well, it's not only asthmatic patients that are required to carry the rescue inhalers with them. So people who suffer from bronchitis, for example, so they also need to carry their inhalers with them at all the time, because you never know when the thing will trigger.
So you spoke about the immediate medication, the albuterols, etc.
Yes.
So what is the long-term medication that is needed once someone have an attack?
Well, we also used steroid in this effect. So steroid is a medication that is used to provide long-term relief to the patient who suffers from asthma. But also the bronchodilator, you can use it also. as a lifeline in any situation.
All right, let's say I have asthma, and how do I know, if am I severe, am I mild case?
Okay. Well, if you have asthma, so we classify asthma, in 4 different categories. So the categories are mild, intermittent asthma, mild persistent, moderate persistent, and severe persistent. So if you have a mild, intermittent asthma, so it is the least severe of the 4 types of asthma that you may have. So people in this category, they may experience symptoms of coughing or wheezing no more than 2 times a week. This is just the mild persistent. So if you have the mild intermittent. So if you have a mild persistent asthma, people in this category will experience symptoms of coughing or wheezing more than twice a week, right? But if you have a moderate persistent asthma, so you may experience coughing or wheezing on a near daily basis. So these patients have symptoms that routinely interfere with normal daily activities of living. So they are routinely prescribed long acting inhaled bronchodilator to manage their asthma. Sometimes they may need to seek emergency room treatment or require hospitalization. So the last one would be the severe persistent. It is the highest level of the 4. So people in this category may experience coughing or wheezing almost continually, mostly every day, day and night. So these are the 4 types of asthma that we may consider. And then there is, an intervention that is taken for every type, just to help relief with these symptoms.
All right, so I think we learned a lot today about asthma, but besides the negative impact that it has on somebody's health, also we need to consider the economic impact. So what can you tell us about this financially? How does asthma impact people?
So again, 30 plus million people suffer from asthma. So that's kids losing school, that's parents having to stay at home, that's people missing work because they have to go either into the hospital, into the ER, or see their doctor. And this health cost is up to around $15 billion. And as you mentioned, Russell, asthma is a chronic issue of the lung, and we're here to give you some lifestyle changes that can definitely help decrease the flare-up, decrease the attack. So this costs on your health, on your time, on resources to be lesser.
Right, so let's start by looking at diet changes that we can make. So you need to start looking at some good food to eat, healthy foods, and foods that are rich in vitamins, especially vitamin A, vitamin B9, vitamin C, vitamin E, and all these things are richly found in fruits and vegetables. You got carrots, tomatoes, orange, and lemon. These are rich in vitamin C. Food with high fiber content and omega-3. So all these help reduce inflammation and trigger and help reduce asthma attacks. So what do we look at in terms of food to avoid?
So the opposite. So again, asthma is a disease is inflammation. We've told you many times before. All disease is some kind of inflammation in your body. So what things that can trigger inflammation are fried food, processed food, flour, white flour, sugar, caffeine, soda. All these things will trigger or decrease your immune system, trigger inflammation. So if you're suffering from asthma and your immune system is already low, guess what? You're gonna be very susceptible to the triggers that will cause your lungs to start, acting up.
So we will also advise that you breathe fresh air. When you wake up in the morning, go outside where there's not too much pollution, and breathe some fresh air. And also, it's a good idea to keep a window crack at home. Yes, especially if during the summer, then open your windows. And during winter, you can still leave one open, and try to manage that.
So just know what outside is gonna look like. Follow the weather channel, Google the weather, how is it gonna be in terms of humidity, in terms of the UV light. When the index is really high, you gotta know that. Wait, I have severe, mild, moderate, whatever classification asthma you have. If you want to stay inside in a cooler area or shade to prevent again the triggers.
I also think that you should know the signs and symptoms of an asthma attack. If you are experiencing wheezing and coughing, persistently, so you should seek for medical advice. And also, prevention is better than healing, as we know. If you keep a clear environment around you, so if you suspect that you're going to have an asthma attack, you should stay away from animals, from any dust, mite that is around you. Try to avoid carpets in your room, especially for kids, at younger age. So avoid, having carpets in their rooms, and this should also helpful in managing this disease.
Yeah, and along the same line, make sure that you wash your linens very
Exactly.
often, your curtains and all these things. You can use some non-allergic sheets and bedding. So, and we also want to mention essential oils.
Yes.
Your favorite.
My favorite. Again, it's like the most cost-effective thing you can do for yourself. There's frankincense, there is lavender, there's lemongrass, and so on and so forth that can, again, clear the environment, clear your house, the air that you breathe in, and prevent any trigger factors in your home.
And we have a video on essential oils, so please make sure to check it out. And also, in this video, you'll see how you can prepare some homemade cleaning products that will, so that you can avoid all these chemicals that we buy at the stores, and that can really contribute, that can also trigger asthma attacks.
Okay.
Yeah. Yep. And couple more things: make sure that you manage your stress well, and please exercise. So I think that's all we have for you today. Thanks again.
Any last word,
Yeah.
Russell?
No, I think that anybody who's watching, they should follow the advice that we gave from this video, and then I think they should be an improvement in their health.
So thanks for watching. thanks, Mr. Russell, for coming here to our home and share these advices with our audience. And we hope to see you again very soon.
Thanks for having me.
Thank you. All right. Be sure to subscribe, like, and share, and definitely comment below. Thank you for your support, and God bless.
Bye.